Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of technology and healthcare are ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. On today's episode, we'll be discussing if AI has finally arrived in healthcare. And be sure to follow the show on Twitter at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 16 years of health IT blog content at healthcareittoday.com. So are you real or are you a robot, Colin?
I think it depends. It depends on what day and what time you ask.
I say that because people have often said that about my Twitter account. They're like, is that really you? Is that a bot? And it's like, no, it's mostly me. There's a little auto posting, that's fair. But it's funny when people are like, you just are there all the time and so many accounts. How do you do it? And yeah, a little bit of automation helps, but for the most part, it's just an addiction.
Well, first step submitting it, John. First step submitting
it. Thanks for we should do a 12 steps episode, but anyway.
So artificial intelligence, AI, the pixie dust, the magic pixie dust that's been spread across everything in healthcare IT for the last little while. Is it finally here? I think that's what we're going to talk about today.
Yeah, it's a good question, right? And I think some of it goes down to terminology. If you use like the really narrow definition of AI, which is the machine actually thinking, then the answer is it's not here. Like it's not really here at all.
Right.
But if we use the marketing version of the term, and since you're a marketer, we're allowed to use that for this entire episode.
That's right. That's right.
Now, the marketing version of the term AI, which you see on every sign at HIMSS or other conferences, it's definitely here. But it really is including other things like machine learning and even data analytics, business intelligence. I actually just got off a CIO podcast, and they won a HIMSS Davies Award, and it was a scoring system for sepsis. They had a number of other things, and he's like, "This is not AI and machine learning." He's like, this is just a simple scoring system with notification and all that, right? And it was an important differentiation, although it produced amazing results. And so I think that's where we're at as far as AI in healthcare. If you include the machine learning and the data analytics, it's definitely there. And even some automation, right? If you use automation as AI, robotic process automation, then it's definitely there. If you do it intelligence, where it's thinking for us and proactively thinking, no, we're not there.
Yeah, I agree with you. I think, using the technical definition of AI, we're not even close to that in healthcare. And I don't see us getting close in the next few years of that, which sort of begs the question, do we really need AI in the classic sense, or do we need all this other stuff, right? The machine learning, the pattern recognition, the NLP, the analytics, as you said. So, one part of me, wants to answer the question from a marketing standpoint. Absolutely, AI is here. AI is everywhere. It's baked into a lot of the applications that you see. Is it true AI from the scientific standpoint? No, and I think that's okay. I don't think healthcare was in a rush to implement fully intelligent algorithms and those kinds of things. I mean, we can't even get interoperability running. So, let's start with the stuff that you're talking about. Let's start with the analytics. Let's start with, the machine learning type stuff and draw some insights from that. And we'll still have an amazing application, right?
Yeah. R2D2 is a little disappointed behind you that, you're talking about AI this way, but it is interesting though, they bring up R2D2 because I'm seeing more and more robots in hospitals as well, whether it's delivering medications or whether it's, sanitizing different areas or, all sorts of different applications for robots. So I think we're actually going to see an evolution there where they do have some smart systems, right? We all have them in our homes now with the the Zumba,
Right.
Roomba, whatever it's called. I think I just messed up a exercise, but anyways, you know what I mean. That sweeps our floor, that has a really intelligent system of how it sweeps the floor, and we're starting to see some of that in the hospitals, delivering medications to different areas, delivering other supplies that may be needed in certain areas. I think that's an interesting place, which is closer to true AI because it is thinking for itself and knowing, okay, what are the levels at, what do they need to be, what was ordered, what's going to be ordered, predicting it. I mean, that's a pretty good level of intelligence.
Yeah, I agree. I know. I think we're far away from the day when a robot is going to diagnose you, or AI is going to do something on that level what a doctor does today. I think, unfortunately, IBM Watson has proven that, right? Like we're far away. One day we'll get there, but we're not there today.
I think the
But
exception's radiology, though. The
yeah,
radiology imaging stuff does pretty good and it's pretty solid. The problem is we expect perfection out of technology and we don't with humans. So that's why it hasn't gotten there.
yeah, and I think we were talking about it before we got on air here that augmenting what we're doing today through these algorithms, absolutely, like what you're talking about there with radiology, being able to detect an abnormal image or being able to flag an image and say, hey, something's, you might want to take a look at this because I detect as the algorithm something is different here or matches some previous scans that we've done and things that are consistent with people who have cancer and so forth. I think, but it's still got to go to a radiologist, right? Like it's still going to go to a radiologist, kind of look at it and make sure, right? And so I think it's great. I mean, it is helpful and it is beneficial, but it's more augmentation of what we're doing as opposed to replacing a human person, at least in the diagnosis world today.
Yeah, the problem is I think of I have a Frisbee friend who's a radiologist, and so we often talk about this subject, and he's tried a couple different systems that have an AI based identification of things he should do, and he's like, well, it's just so much faster for me to do it myself. And he's right. Like that's actually the nature of every technology we adopt. In the beginning, it is faster for you to just do it. But over time, as it gets better and as it learns from you and it learns from those mistakes, then that's not the case. The question is, where's that tipping point where we start saying, oh no, actually, I trust the AI more than I trust a human for a whole subset of reads on radiology reports. Like that's going to happen. It's just how quickly and what will it miss and how will we handle the fallout of what it does miss, and how will we address that?
Right. But I think AI in healthcare is actually going to mirror AI in other industries, right? Like you're talking about an autonomous robot, right? That one is able to wander around and go to the right room, deliver the right medication. Well, the same thing happens on a manufacturing floor plant, like the same kind of robot, right?
Exactly. Yeah.
You'll maybe have one day a robotic gurney that does the same thing, right? And or something related to AI smarts in the HVAC system that is able to control where the air needs to go and doesn't need to go and be able to make the hospital more efficient. I think AI in those applications, which is sort of more universal, it's sort of beyond healthcare. I definitely think healthcare will adapt and use those because it's going to be proven elsewhere, right?
Yeah, that's
but
true.
but healthcare specific AI, I think we're not quite there yet for sure.
Yeah, we've
Uh,
seen some really interesting stuff, which this is an element of AI, at least machine learning in the systems, monitoring patients in the room. Now, there's certainly bed sensors and there's some AI on top of it to try to predict, is there deterioration of health and things like that. But some of the more interesting ones are like, they even have like a LiDAR system that is watching the room and watching for movement, and it's watching for who came into the room, who came out, and then they also have camera ones doing it as well. And hey, are they getting up? And oh, this person's a fall risk, so why are they getting up? Let's notify it, right? And that is some actual AI, some intelligence that's looking at the data and saying, okay, that movement was just them rolling over in the bed versus, hey, this is them standing up, and that is a very different thing that it's identifying. So that's actually the beauty of AI in this case, is that it can be applied to everything. This automation, this learning, this understanding of data. The question is, where are we going to do it, and how do we do this, across a very complicated health system?
John, do you think we've sort of been held back from deploying AI in healthcare? Like, is there anything that's sort of been a barrier to its acceptance or its adoption
Mhm.
here?
Yeah, I mean, I think there is a cultural thing. Says, oh well, do no harm, right? That means we shouldn't take any risk. That's kind of what's been described there, but which isn't fair. It's not fair to the AI because humans have do no harm and they do lots of harm, right? So I think we have to be careful there. So I think that's one. The second is the data. Just having access to the data and the quality of the data has just not been there to do what we would have wanted to do. And so I think the data is going to be still a big barrier. And then I think the third one is we have so much low hanging fruit that analytics is enough to really make an impact that we haven't needed to tap neural networks to understand something else. Right. So I think, those are my top three.
Yeah, I definitely agree with that third one of yours. That was going to be my number one. I think healthcare has got so far to go through no fault of its own, in the sense of I don't blame healthcare for where it is. It's just it is where it is. But I
Mhm.
think we can get so much more effectiveness and benefit out of some simpler technologies that don't go all the way through to a neural network, or to the sophisticated AI algorithms. Let's start doing that a little bit more. Let's start using more data analytics. Let's start using a little bit more of those kinds of tools and get the benefit, and then we can move to the next phase of being ready for AI, as you mentioned. So
Will the
I
next phase hop over though? Like, you know what I
hopefully.
mean? Like, because that's what happens with technology a lot of times, oh, just good enough, do small things. And then someone comes along with an AI powered EHR that now auto documents, et cetera, right? Does value based care in a better way. And then there's like, well, why do I have my EHR? This looks way better. I don't know. I don't know if that's going to be the case, or maybe even new technologies come in that are on top of the EHR, which is still just the billing system. I don't know. It would be interesting to see.
Also, I think that there is a gap between expectation and what is being delivered.
Mm,
You made that point before. I think maybe we are expecting too much out of AI, and AI today is not ready to deliver that. Right. And so because of it, we're not willing to adopt sort of, well, I'll just wait until it gets better. Right. I'll just
yeah.
wait until I can get that vision that I have in my head about what AI should be able to do for me. So I won't adopt it right now. I wonder if that's another factor in why AI has not been more widely adopted, at least on the clinical side of the
That's a
house.
great way to describe it, right? It's just, it's that fear that it's like, well, it's not what I thought it should be. So it can add value, but it wasn't what I thought it was. So maybe I should wait till it gets there rather than accepting that, hey, perfection is the enemy of good and moving on.
Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're discussing whether or not AI has finally arrived in healthcare. So, John, let's get to some fun stuff here. What health IT companies specifically, do you see leveraging AI effectively?
Um, every company. I don't know. You ruined me with the effectively at the end. But I mean, it is interesting, right? Like, is there a health IT company that doesn't have an AI strategy?
It's true.
Like, I think it would be a mistake to not, right, and not to have some sort of effort in this regard. I mean, and we've seen it across so many things, all the way from AI scrubs analysis of how many scrubs you should have available, which is just insane to me, right? But when you watch it, you're like, actually, no, it makes sense because that's a really expensive thing for an organization, and they need to manage it properly. But yeah, I mean, there's a few that come to mind. Lirio is one that I think has been interesting, and trying to do like true AI learning rather than just basic analytics stuff. So I think they're interesting. The leader actually in all of this is NVIDIA. NVIDIA is what's going to power a huge chunk of all this AI that's happening. And so they're really going to be the workhorse behind it. But they're creating some tools that anyone can tap into. So we talked about data access as a problem, and how you need the data to train the AI engine, or you need the data to test the AI engine, or you need the data to be able to do whatever. NVIDIA has been working on that. So if you want to train it on medical terms, they can already do that. They already have all the medical terminology, and they've trained the AI engine to understand the medical terminology. So, they're the ones pushing it forward, I think, and are going to be that engine underneath thousands of health IT companies that, with their GPUs that are able to process everything that needs to be processed to do this effectively.
Yeah, those are good ones, John. My mind goes to, a couple of more administrative style AIs. Of course, I think of AI being used in the revenue cycle side, right? Coral Health recently, was featured in a class spotlight report for their autonomous coding, right? So they have an AI engine that sort of looks at the way doctors document and is able to quickly translate that into the proper coding and so forth for billing. So I definitely see some applications there. And again, it's because it's so focused and not in a clinical area, so to speak. I think, people are adopting it. And in fact, that's what the Spotlight report was saying, is that people who have adopted it have definitely seen some benefit to using this form of AI. Another company that I bumped into recently, Leantas, right? They're using AI to optimize and maximize the use of ORs, which of course is really important right now to try and get through the backlog, right? But they look at past historical information, but also, how each of the surgeons operate and when they have to operate and the timings and all that kind of stuff. So it's a mixture of ML and AI, but really helping organizations optimize the use of their ORs at a time when they've got to do more with less and got to maximize the utilization of that precious resource.
Yeah, I see it also happening at the digital front door. And yeah, I think the obvious one is the symptom checkers. They've gotten pretty good. I mean, they are kind of a system of if then questions. So I don't know if it's full AI yet, but they're going to mature quickly, I think. And that's going to be interesting to see. How much are we going to trust these symptom checkers to route us to the right care? And it's gotten more complicated. Do we even trust it? COVID's ruined some of the trust there. So, will we trust an AI? Or in fact, maybe I trust an AI more than a human because of that. I don't know. I think that's going to be an interesting space, to see. But we're also seeing the AI applied to who needs to be outreached to as part of these communication systems, as part of the digital front door, making sure you come back for your wellness visit, for your mammogram, for your follow-up visit. The AI is starting to do that. And I love it. Care Cognetics talks about digital workers. And I think that's a really cool way to look at AI, is saying, how can I deploy these digital workers to be able to solve some of the problems that we, either don't have the staff to do, or, the scale of the problem is just too much. You can't scale humans to. Our friend, Linda Stotsky always talks about this with Boston Software Solutions, right? And using robotic process automation and, this digital worker concept, if you will. I don't think that's how they frame it, but, automating those processes for people so that they can do it so much more efficiently. And, I think in the past we would have looked at this and said, oh, you're coming for my job. But the answer now is like, no, we have to do this because I'm sick of doing 5 people's job and I'm not going to survive because we can't hire enough people. So we need to hire the technology to come and augment what I'm doing.
Yeah, I wrote about that recently in an article where, AI once was seen as the enemy, right? It was the enemy of what I do because you're coming for my job. And now it's like a savior because, you're taking one of the 9 jobs I have away from me. And that's a good thing because we're all doing so much more these days because we don't have the resources, we don't have the people there. And so, yeah, I think we could be in the golden age of AI without realizing it, where people are now like, I have to implement these things because I got to take some workload off somebody. And right.
Well, how does ambient clinical voice and that technology fit into this AI discussion? In some ways, it's like a virtual scribes. And class just came out with a report about virtual scribes. I was like, should they have included all these ambient clinical voice solutions, which are kind of a virtual scribe with some AI on the back end? The Suki CEO one time told me, he said, hey, if we're effective at doing ambient clinical voice, we essentially have replaced the doctor. I don't know if that's fully true, but it is interesting to think about, because if we're literally able to take the full conversation and document everything that's being done, then did we just create a doctor? Not quite, because the doctor's saying some things that the AI is picking up, but there's definitely an element there of like, okay, well, how far are we? And how far are we going to go with these ambient clinical voice that are listening and doing the documentation for you? You know, I love this space because I want this to happen in a big way because we all will celebrate and have a party that we don't have to deal with the minutia of documentation. But the question is, will the AI be able to? Suki CEO says he didn't think so. He's using it in other ways to automate the documentation, but he's like, no, you can't do all of it, which I think is an interesting discussion.
Yeah, I mean, I use the marketing term, as you well know, of AI, right? So I lump NLP as a variation of AI or under the AI umbrella. And so when you look at tools like Nuance's DAX product and so forth, I consider that AI because it is taking something that a human is doing and then automating it, which in this case was scribing, but it's doing it in an intelligent way. It's not just sort of doing a transcription, right? It's actually interpreting what the patient is saying. It's interpreting what the doctor is saying, putting the information in a coherent manner into the EHR or whatever it's doing in the back end there. So I definitely think it's AI. And I definitely think, we're all very much anxiously looking forward to the day that it's more ubiquitous and more flawless than it is today. I mean, I have heard stories about DAX being very successful. I've heard there's been some learning curves to it as well, but the point is at least it's being tried, right? At least people are starting to adopt it, and that's a great step forward for this technology.
Yeah, and I'm grateful that 3M, which bought M-Modal, is in on the fight a little bit, although I'd love to see them do more because I think competition matters in this space. So, the more competition, the better from a patient perspective.
So John, where in healthcare do you think we need to use AI more?
Yeah, so the one I would love to see more of is in the view of the documentation. So right now, when you look at EHRs, they all look kind of the same. You can customize which dashboard you want. And, Advanced MD's done some cool stuff in how they display some of the data that I think was interesting. I wrote an interesting article about that and featured some of the, I think they call them donuts, right? And you can kind of see the donut and how you're doing. And it's interesting. There are some cool things there, but for the most part, it's like, here's all the data on a patient. And we know that that's not how it should be done. Like if we were designing the best system, we would look at it and say, well, the doctor only needs these relevant things. And if you ask a doctor, they know what things they need for that situation. And so we need the EHR vendors really because they are controlling the interface and for good or bad. If they want to open up their APIs, then this would happen in a really interesting way with a bunch of entrepreneurs who would go in there and do this for them, but they haven't done that, at least to the extent they need to for someone to redo that interface. And so I would love to see them dive into how smart they make it. And they're going to get kickback in a big way because the doctor's going to be like, wait, my blood pressure was always at the top in the red and the whatever, and when they start making it smart, the doctor's going to be like, wait, you messed this up. I used to that. And so that's why they haven't done it, I don't think. But I would love to see that, the data presented to the doctor in a much smarter way. And maybe they start with one area of that interface to say, hey, here's the smart UI that we think of what you'll need. And then over here, you can have the more static stuff that you're used to. That may be a way to kind of wade into that area.
Interesting. I'm going to take a completely different tact from you and say, the area I would love to see more use of AI in healthcare is actually on the cybersecurity side. Right. I would love to see more AI being deployed in terms of protecting the network, protecting the data, making sure that the applications are up and running and the systems are available and those kinds of things. So I see AI used for infrastructure management. When I say infrastructure, I mean IT infrastructure, but could be extended to physical infrastructure too. But more on that side of things, because, as we know, attacks are getting much more sophisticated. They are using AI, right, on that side of the house. It's time that healthcare and businesses in general adopt that, use AI for the defense. And we're starting to see that obviously with some of the products that are coming out from companies, right, like NetScout and others are, so I'm looking forward to seeing more of that on the infrastructure side.
Yeah, and we've seen a little, like VMware has done some on their virtual machines and who they're communicating with and tracking that and understanding it and profiling it. And then when it does something different, it flags it and warns people that, hey, something might be going on here that we need to be checked out. We've seen it in some of the EHR audit logs, right? Where they have deployed some AI and machine learning on top of it to understand, like, oh, wait, so this person never accesses this and now they did. Is that a potential breach? So we're seeing a little bit of it, but you're right. When you look at the volume of attacks, no human is going to be able to do that. It's going to have to take an AI engine to be able to address it. So that is a big area.
Definitely. I think the other last one I will say is the area that you talked about before. I'd love to see more AI in the patient experience side of things, whether that's on the communication, the check-in, all those kinds of things, the reminders that go out to say, hey, based on your profile, you might want to come in and have this done. Those to me is another area that we definitely need more AI.
So you're sick of calling in for appointments. You'd rather schedule an appointment with a bot. Is that what you just said?
I would just be, I'm Canadian, so I would just be happy with a doctor texting me. So that'll be a good thing.
Yeah, I mean, it's an interesting balance, right? I look at it and I'm like, yeah, we've talked about before, I'm the self-checkout guy that wants to do it myself. So I want to go in and schedule my appointments, optimize myself as well. But I know there's some people who love to call and just get the appointment that way. And I also, for as much as I am a self-service kind of person, sometimes there are times, I was just doing rental cars and I knew I could do it online, but it was a last minute thing. And I had to make sure, did they actually have what I needed? And so it was necessary for me to get on the phone to make sure I didn't just book it and then get there and there wasn't a car. The same thing happens in healthcare. Sometimes we need to talk to the person. We can't just rely on the technology. And so it's a fun balance.
It is indeed. Hey, listen, thanks to all of you who tuned into this episode of Healthcare IT Today. You can find out more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on Twitter using the hashtag HITSM. I'm Colin Hung with my friend and Health IT collaborator, John Lee. Thanks for listening and have a great week.